So today we have our beautiful patient Deb, and we're planning to do surgery for Deb. What bothers you the most about your face? And we're going to talk about how we can best address it.
Well, I've got a couple of concerns. First, over my eyes. I find that the hoods of my eyes, I'm not sure what you call it, are very heavy. It's like they're laying on top of my eyelids.
Okay.
So I feel like my eyes are disappearing. And then secondly, this part of my face I really don't like. Like I have a lot of lines here just from over the years. And then I'm just getting these indents here and a bit of saggy here. So those are my main concerns, yes.
Okay, perfect. Well, we're just going to go over the plan once again
Okay.
and walk through it step by step.
Okay.
So, one of the things is the quality of the skin, especially those lines around the mouth. And so what we're going to do today is we're going to do that carbon dioxide laser resurfacing to really treat the whole face, really address some of these sun damage changes and especially these lines around the mouth. And that usually works wonderfully, and that really works on the quality of the skin.
Right.
And that's going to set us up nicely for surgery ultimately. Okay, so I'm just going to walk through things in detail.
Sure.
And things that we've chatted about. So I'm going to start from the top down
Okay.
and walk through things. So the first thing we're going to do is the brow. So your brows aren't in bad position, but you can see how if we address the face, we get some wrinkles in this area. And the best way to address that is to do a brow lift. And so we're going to plan to do a temporal brow lift. And so how we mark that out is we feel where the conjoint tendon is. Right, this muscle is your temporalis muscle, one of your chewing muscles that goes up here. And we're going to plan about a 2 centimeter incision here in the hairline so that it hides nicely in your hairline. Now what we're going to do is go down and release the brow to bring that up nicely so that there's not going to be any redundant skin when we address the face. So the next thing we're going to do, I'm just going to have you close your eyes if that's okay, is address the eyelids and open your eyes there. And you can see that there's some excess skin here that we want to treat. And so we're going to have you close your eyes again, and we're going to find, I'm just going to be poking around here, exactly where that crease is. So there's a little bit of cartilage above the eyes here, and it makes a very natural crease. And I'm going to take out this redundant skin, and we're going to carry this over to the corner of the eye. I'm just going to have you open there for a moment. We're gonna do a little bit of a pinch test. Sorry, Dad. Just gonna grab this. And we're gonna just pinch to see how much redundant skin there is. You don't want to take too much. We're always going to be on the conservative side. Here, you can see there's a very natural place where this incision wants to be that we take to the part of the outer eye. You can also see that there's a little bit of excess fat that's pooching just on the inside of the upper eyelids. And so when we do our surgery, we're going to address that as well by taking out some of that fat. Okay? All right, and I think that's going to do a wonder between the brow and the upper eyelid to really open those eyes, which I think will be great. So we're going to move to our facelift incisions. So again, we're going to go through a temporal tuft incision, and we're going to mark it out just in some of these finer hairs. And some of those hairs will eventually grow through the incision, making it even less obvious, which will be great. Okay, and then we hide the incisions in the shadows of the ear. So the first one comes down just behind the upper ear, and then we're going to come behind this cartilage, we call it the tragus. It's going to come behind the tragus, and we're going to come out this way into this prominent fold. Again, the incision really sits behind the ear. And we feel where this bone called the mastoid becomes flat. And then we take this out to the hairline. And then we're going to come down the hairline. And that's about all we need behind in order to do our facelift. And so, again, we're going to do a deep plane facelift for Deb. And the advantage of that is that it gives really natural results. So people used to just lift up the skin and just suture the skin back, or maybe put a few stitches in the deep layers. But now what we know is going in the deep plane, it really addresses these fat pads and the gels to put them back very naturally and suture those in position so that there's really no tension of the skin. And the benefit of that is it gives a more natural, non-pulled approach, number one. Number two, putting little or no tension on the skin for the incision lets it heal optimally. And so marking out the incisions for that, we mark the line of Patenge, which is midway between the brow and the hairline here, and then the bottom of the lobule. And this is the approximate location of the frontal branch of the facial nerve. Then we mark out a separate line from the corner of the eye to the gonial angle. So that's the angle of the jaw here that we're going to really sharply define. And we draw a line there. So that's the classic deep plane entry point. I'm going to utilize the sailboat modification. That is this triangular shape, like so. And with that modification, this deep plane of tissues, you're bringing it right into where the incision is. So there's a multiple layer portion of tissue that you're bringing back here and suturing that in place, and then we trim the skin, okay, to give that really natural result, to bring these cheek fat pads up as well as these jowls back into position. So now we're going to go to the neck lift incision, and that's to really give her a very sharp angle. You can see that, or at least I can feel that her submandibular glands, which are two salivary glands, are dropped down, and that's part of the lack of a sharp neckline, and we really want to make that very sharp from her. So we make her incision. I'm just going to have you tilt your chin up a little bit more on the inner border of the mandible. So we really come around right here. Okay, I'm going to make sure we mark our perfect midline here. Okay, we're not going to use all this incision, we're just going to use about a 2.5 centimeter incision here. And what we're going to do through here is it lets us access the platysma. So there are two sheets of muscles and over here, and we're going to reduce some of the fat here. We're going to go and we're going to reduce some of the submandibular glands on both sides. And then we're going to suture those two sheets of muscle together in the midline, do a little relaxing incision. Those sheets of muscle, when we're in our facelift incision, we're going to bring up and we're going to really tuck under the bottom of the ear. And that's what's really going to give this very nice sculpted neckline and new contours. So we're booked to do this in a few weeks, Deb.
Yeah.
And thanks for being our model here, and I'm so excited to see your final result.
Me too.